Evening Facebook. It's been a couple of weeks since I've done this. Have you missed me? Everyone's here. Everyone's here. Hello? Is everyone here? Right. Okay. I know everyone's missed me, and I know they'll be here in a minute. So probably just a bit delayed, but that's okay. I'm sure they'll be rushing through the doors any minute. But anyway, just us then at the moment. But that's okay. You can't expect to miss a couple of weeks, and then maybe people will drift away. But anyway, I'm back now. So I've got some questions which I will merrily go through. If anyone does turn up and has a question, then you can ask it live, or you can just message me if it's not live, because I'm sure lots of people watch this on the replay, so it's still very, very well worth doing. I'm going to start with this question, if it's okay with you. Can I have a breast reduction but then have implants at the same time? I've spoken about this before, and the answer to that is, can I? Yes, you can. It is kind of a thing. The reason being that people have a breast reduction because their breasts are too big. So if your breasts are too big, then you would make them smaller. So you might say, why on earth would anyone have implants at the same time? Because implants make your breast bigger. Well, the reason is that breast reduction, I personally always make it very clear to patients the sort of shape of breast that can be achieved with a breast reduction, because see what that button does. Oh, it's snowing. So because it does have less fullness in the upper pole than you might think if you were sort of talking to someone saying, I'm having a breast reduction, or okay, that's enough of that. If I'm having a breast reduction or a breast lift, because a lift is an integral part of a breast reduction, you might think that your breast is going to be up here. And so personally, I always show photos of the sort of shape that can be achieved with a breast reduction, because it never kind of stays up there. It always settles. And some people say, well, I don't like that shape. I want to have fullness in the upper part of the breast, in the bit above the nipple. And if you want fullness in the upper part of the breast, that you can't do that with your own tissue. When you do a breast reduction, you put all the fullness above the nipple. You put all the fullness in the upper pole of the breast. And to be frank with you, it looks a bit odd when you first have a breast reduction, and then it settles, and it settles to a more natural shape, but with less fullness in the upper pole, with a concavity in the upper pole. And some people say they'd like to have more fullness in the upper pole, and that's where implants come in. Implants will give you more fullness in the upper pole, but they will make your breast bigger. So the problem with doing implants at the time of breast reduction is it depends on how big you want to be. So I guess if you said, oh, I'm happy with my size, but I just want more fullness in the upper pole, and I'm not happy with what can be done with a mastopexy, you could remove volume and replace it with an implant. Or if you wanted to be smaller, you could just kind of over reduce the breast and then add an implant in. So those are technically possible, and people do it. I don't think it's a good thing to do, to be honest with you. I don't like the concept of removing healthy breast and replacing it with implant, although I understand why people do it, because patients want the kind of look that can be achieved with implants, but don't necessarily want to be bigger. Because obviously if you want to be bigger, it's easy. Then obviously you would put implants in, because that's fulfilling two things, making you bigger and giving you the shape. But if it's just purely for shape, personally, I don't use implants purely for shape. I'm just pressing the button just to check that. It's actually odd. I don't use them fully for shape. I only use implants to make breasts bigger. So I don't do this plus minus technique, or whatever people call it. I don't do this reduction with implants. It's not something that I personally do, but it is something that is out there in the world and can be done. So if you want me to do it, then or if you want this procedure, don't come and see me. But it is a procedure that exists in the world, so you might be able to find someone who'll do it for you. As I say, I can understand the rationale behind it, but personally, I don't like it. I don't like it. Do we offer gastric sleeve surgery? No, it's quick, simple answer. So gastric sleeves, so weight loss surgery like gastric sleeves, gastric band, and all that. That is what would be called a bariatric surgeon, which is a general surgeon. General surgeons, a general surgeon does sound like quite a general term. Well, it is, isn't it? General, but they're not actually general. They're quite specific, and they're usually kind of around the bowel. They do bowel surgery normally, so it will be a subspecialty of general surgery, not plastic surgery. So all surgeons or all surgical specialties have subspecialties, and gastric sleeves and bariatric surgery, weight loss surgery, is a subspecialty of general surgery, not plastic surgery. So kind of body contouring and cosmetic surgery is a subspecialty of plastic surgery. So we would do the body contouring once you've lost the weight, but we don't do the surgery to enable you to lose weight. So gastric sleeve would be a bariatric surgeon you're after for that one. Why is there a crease in my areola following gynaecomastia surgery? Full disclosure, this is not of my patient. This is a patient who has got in touch asking for help a couple of, well, maybe not a couple of weeks or so ago. And Amy showed me the photo and said, look, really, really want to help this chap. And I said I couldn't help because one of the problems with surgery in general, but particularly with gynecomastia surgery, is kind of you're fighting against scar tissue, and you can do too much. And if you do too much, you can get contour irregularities and dents. And this person had quite an obvious crease underneath the nipple where there'd been over resection. And I can understand it. It's a difficult operation, gynecomastia, because there's kind of always a tendency to over resect, because patients usually the complaint is, oh, you've left some behind. Personally, I always leave a couple of centimeters behind the nipple, even though patients say, get rid of it all, I don't want it. And they might say, oh, it's still lumpy behind the nipple, but it looks good. If you take away too much, particularly behind the nipple, once you start getting that crease, even worse, you can start getting the nipple sitting in a kind of dent, in a crater deformity, they call it. So that is something that is very hard to fight against, because you're fighting against scar tissue, and scar tissue, when we do surgery, all we do is create scar. That's all we do. So how do you get rid of a scar? By creating the scar. Anytime any surgeon touches you, they create scar. So it's extremely difficult is the answer to that. Monica's, look at that, Monica. God, just as I thought I was one of my own. Monica's get. Thank you, Monica. That's jolly kind of you to say that. Just when I was in a slump there, and Monica's built me up. Thanks, Monica. Yeah, so it is very difficult to get rid of a crease, and it sounds absolutely unhelpful, I know, to say it's better to do it right first time. I know that's really unhelpful to someone who's got a crease, but one of the problems with surgery is revision surgery is really hard, and that is why it is very difficult, certainly in my practice, when people contact us who've had surgery elsewhere. Many surgeons will not be that keen to kind of take on problems, because they're always more difficult to fix than the original surgery. So, doing a gynecomastia, doing a breast augmentation, breast reduction is difficult enough, but doing one where they've got problems, particularly if you've got problems with scarring, too much taken away, things like that, really difficult to treat. Always best, as I always say, to go to regional surgeons, they've got an vested interest. And sometimes, like in this case, the risks of kind of doing something outweigh the potential benefits. So in this case, I just couldn't help. It sounds bad, but I couldn't help because I'm worried about making it worse. That's the thing. Whenever you do surgery, you can make things worse. So yeah, it's a tricky one. So yeah. Do we offer lock and glue? tummy tuck. So this is, it looks like we've got two questions in the lock and glue arena. This is related to Cece, my colleague Cece, who has a clinic round the corner, Cece Cat, who has sort of popularized this lock and glue. I don't do it personally. I don't use glue for tummy tucks. Glue has been around for quite a while, and the concept is to kind of close down the space that is there when you do a tummy tuck. So when you do a tummy tuck, there's a space because you have to undermine all the way up to the xiphisternum in order to pull the tissue down. So there's a big space there. So that space could potentially fill with fluid in terms of seroma. That's kind of like the worry of a tummy tuck. That's one of the kind of risks of a tummy tuck, and so you want to kind of close down that space. The way initially what I used to do is suction drains, and this is what the glue has kind of it's become popular because you don't use suction drains if you're going to use the glue, so the glue will stick down the surfaces, so it avoids drains, which means that people don't like drains basically, and potentially you could do it as a day case, things like that. So there are benefits in doing the glue. And in order to do the glue, because you have to hold the glue in place, it's a bit like if you've got like a china pot, you know, and you've broken the handle and you glue it, you have to kind of put elastic band around it because you have to hold it in place for the glue to set. Because if it moves, then if it moves a little bit, then it's gone. Then you can't kind of put it back in the glue. So you kind of have to hold it in place. So because you have to hold it in place, when you do a tummy tuck, there's usually a lot of stitching to stitch the lower incision, and so the lock thing is using a locking suture, which is a barbed suture, which will just go over and over, which will close that much more quickly than doing the usual technique of doing lots of interrupted sutures, because that would take too long. You wouldn't be able to hold that skin flap down while doing all those interrupted sutures. So that's why the sort of locking suture goes in hand with the glue. Yeah, and personally, I don't use it because I haven't really used the locking suture much. I'm not a massive fan of the locking suture personally. It's quite difficult to use, and I guess there must be a learning curve. I haven't really embraced it because you can't go back. Once you put a stitch in, you can't go back and do it again. So you have to kind of pretty much know what you're doing. It does, no question, make the operation a lot quicker. I also worry about coughing. So I think I'm answering the second question here. So do we offer lock and glue tummy tuck? No, we don't, because I use drains. I use suction drains, and I know people don't want drains, but I do. I still use drains, but I also use quilting stitches to sort of close down that space. So Monica's got something. I'll read that in a minute, Monica. Sorry, but lock and glue tummy tuck versus standing tummy tuck. What's the pros and cons? So I don't want to say standard. No tummy tuck standard. Some people are given names like Brazilian tummy tuck, lock and glue. Then it's kind of names. You want to think what exactly. Sometimes people say, "Do you do the Brazilian tummy tuck?" So let's say, "What do you mean by that?" And often they don't know what they mean by that. They don't know what they're kind of asking for. So a lot of things they talk about in a Brazilian tummy tuck, for instance, is what we do. The only thing we don't do is liposuction of the upper abdomen, but certainly narrow tunnel centrally. Anyway, we're not talking about Brazilian tummy tuck. We're talking about lock and glue. So yeah, the benefit of the lock and glue is that it is quicker, and I don't do it, so I guess you should speak to someone who does it for the benefits. But I can tell you the reason that I still use drains and I use quilting sutures. To be honest, I'm probably thinking whether I need to use drains with the quilting sutures, because the quilting sutures do a good job, and I like the quilting sutures. So probably could think about not using drains, but it's one of those things where it's difficult. Surgeons often get kind of entrenched in their ways, so I'm still using drains, but the quilting sutures is what I do, and drains is what I do instead. And I prefer to be able to sort of put individual sutures in the lower abdomen to close it, which admittedly does take quite a bit longer, but it's just what I've always done, and it's what I prefer. And as I said, I've never really embraced the locking suture personally, but I know a lot of people do use the locking suture, and it is popular, I think, in plastic surgery world. So it's, there's obviously different strokes for different folks. So yeah, I always, say to people, find someone who you think is talking reasonable things and has got reasonable results, and it kind of doesn't matter so much what the technique they use is, because there's lots of different ways of getting good results with different techniques. It's probably less about the technique than the surgeon. My 8-year breast implants done by you are still in tip-top shape, like a brand new. Highly recommended, Dr. Staiano Plastic Surgery. Look at that. And that is a non-paid for endorsement. Monica, thank you very much. 8 years down the line. Good to see you here. How are you doing? Hope you're well. Jolly good of you to put your vote of confidence in. I very much appreciate it. And thank you for that. It's nice, unexpected in this evening. Thank you. Very kind of you. Do we offer treatment for Nevus of Ota? I've had 2 inquiries for this. Is it the same person, you ask yourself? Because I'm not sure how common Nevus of Ota is. I don't think it's that common. So we've had 2 inquiries literally in about a week. And then I can't ever remember getting an inquiry about this ever before. Must be the same person. Anyway, no, bottom line, no. I mean, Nevus of Ota is... So bottom line, actually, is if you've got a thing, send us a photo. So if you've got a thing, send us a photo. But Nevus of Ota is usually sort of pigmentation, and you can have pigmentation of your eyeball, of the white of your eye, can have like a bluish sort of dark tinge, and we wouldn't be able to do anything about that. That will be an ophthalmologist. Don't even know if they can do anything about it, to be honest with you. But if you have something on your face, certainly if you have a discrete lesion, if you've just got a blue tinge of the skin, not so much. But if you've got a discrete lesion, for sure. So rather than saying kind of Nevus of Ota, if you send us a photo to our WhatsApp, we've got a WhatsApp it's on the website and stuff like that, or you can just email us, or however you want to send a photo, we can give you an idea if we can help you. But Nevus of Ota usually is quite a distinctive thing that is more of an ophthalmic surgeon's remit rather than a plastic surgeon like myself. Do you know what? How long? I think I've been away 2 weeks. Kind of would have expected more questions than that. I've got to be honest with you. But you know, that's okay. That's okay. I'm not complaining. Monica, lovely. Thank you for the comments. And I am not knocking it, and I'm saying if you have got a comment, please call me or get in touch in one of the usual channels, and I'll be more than happy to respond to your comment. And I know Instagram's been quiet, but I think that's the problem with Instagram rather than me. I can't but for a second believe it was anything to do with me. It must be Instagram problem, that's for sure. So I will bid you good night, and I will say thank you for being here, and I will see you again next week. Same time, same place.